Week of the Canadian Nurses Association webinar series or conversation series called Coffee with Claire. For those of you who are tuning in for the first time, my name is Claire Betker and I'm the president of the Canadian Nurses Association until June the 22nd. So I'm counting down the days until, and not with gladness or good anticipation, actually with sadness and wondering what the next chapter holds after that, because it's been a distinct and incredible privilege to be the president of the Canadian Nurses Association for the past 2 years. But I know that on June 22nd, the chain of office will move to Tim Guest. He is from Nova Scotia. And he is going to embrace that opportunity of president of Canadian Nurses Association and will do an absolutely incredible job. So I have full confidence in the future and on the way forward. I'm a long-standing registered nurse from Manitoba, and I'm sitting in my home in Winnipeg, Manitoba, where I have the distinct privilege of working remotely as the scientific director for the National Collaborating Center for Determinants of Health, which is hosted by the St. FX University in Antigonish, Nova Scotia. So this topic today is near and dear to my heart and to my practice experience. But before we begin, I would like to acknowledge that the land that I'm speaking to you from, that I'm sitting in right now, is Treaty 1 territory, the traditional territory of the Anishinaabe, the Cree, the Oji-Cree, the Dakota, and the Dene people, and the homeland of the Métis Nation. And it's a distinct honor to be on this land. We decided to hold this webinar series or this conversation series to give the Canadian Nurses Association and our executive and our board of directors and our staff an opportunity to connect with our members on really important issues related to the COVID-19 pandemic. And today's discussion will focus on the impact of COVID-19, the pandemic, on Canada's vulnerable populations. And for me, it's always a struggle whether you use the word vulnerable or disadvantaged or marginalized or those words. And I think in principle, we need to ask the people, the folks, how they would describe their situation. So, but today we're going to use the word vulnerable. So I'm joined by two experts. We're thrilled to have our two experts with us here, our two nurses who are experts in this area. And I'm going to ask them now to briefly introduce themselves. So we'll start with Vanessa Wright. She's a nurse practitioner at the Crossroads Clinic out of the Women's College Hospital. So Vanessa, welcome.
Thank you, Claire. It's a pleasure to be here, and thank you to everybody who I can see on the panel and to everybody else who I can't see who's listening out there. It's a real pleasure to be here. As Claire said, my name is Vanessa Wright. I am a nurse practitioner. I work in a refugee health clinic, but I come from a variety of backgrounds, as many nurses do in terms of acute and community care. My mom was a nurse, and I always remember her saying, you know, you'll never get tired and bored of nursing, and it's true. I am constantly learning every day, and I feel energized by the people I meet, but also the different subject matter that I'm constantly learning. I've had the privilege of working in both rural and urban settings in various countries and communities. And I fell into the work of a refugee health clinic about 8 years ago after I graduated becoming a nurse practitioner. And it's been a really great fit. I work with a great team, but primarily work with a great population and a great community of partners that are around us. I am also sort of in parallel to the work of the refugee health clinic, which I'll talk about in a bit. There was some outbreaks in some shelters that we work at primarily in refugee health. And at the same time as that happened, I stepped into a role of being a community site leader for the mobile clinics. And so that's allowed me to travel through various shelters and congregate living settings in the city of Toronto, and again, collaborate with amazing community partners and be able to provide innovative ways of access to care through mobile testing. So I'll talk about that in a bit, but that's a bit about me.
Thank you, Vanessa. And I would agree, you'll never be bored as a nurse. And I say to the students we've had an opportunity to speak to, thank you for choosing nursing. It won't disappoint you. And the opportunities are so diverse and so interesting and so many in terms of being able to make a difference and to learn every day, but also to serve our communities. So we're also joined by Myriam Kaszap. She's an outreach nurse at, I'm going to say it, Médecins du Monde Canada, or Doctors of the World. So Myriam, can you introduce yourself, please?
Hi, as Claire just said, my name is Myriam Kaszap. I'm really happy to be here. That's a great opportunity to be on this panel, so thank you so much. So as Claire said, I'm an outreach nurse for an NGO, Médecins du Monde. We have a clinic where we deliver primary care to migrants with precarious status. Prior to that, I worked I worked in street health, so as an outreach nurse on the street within the healthcare system here in Montreal. And prior to that, I worked in forensic psychiatry as well. So, so that's kind of my background that I'll be sharing a bit today.
Thank you, Myriam. And again, a really interesting background. And Myriam, you also hold a PhD. And now that I didn't see your picture the other day, but looking at you, you're very young to have those many accomplishments and that educational achievement. So congratulations and good for you. So on behalf of everyone at the Canadian Nurses Association, I want to thank both of you for taking the time out of your busy schedules. I know, Vanessa, you rushed from one place to the other to be with us here today for this very, very important discussion. So like previous episodes or previous conversations, we pre-met this session today, and we crafted a couple of questions based on some of the input from the chat box and from the Q&A box that I'll point out in a minute from our audience, from those that have participated in it, and also crafted a question to be able to address some of the contemporary issues, like right now around anti-Black racism and anti-Black police violence, and some of the things that are going on right now, right today in our world and in our country. So we've crafted some questions, and I'll ask those questions, and then I'd like to invite the audience, you that are participating, to first of all introduce yourselves in the chat box there. There's two places at the bottom of your screen. If you hover your cursor over it, you'll see them. One is the chat box, so use that box to introduce yourselves. If you've got resources that might answer some of the questions that our guests are talking about, please feel free to put them in those chat box, and our staff will be adding resources. You can see some of them that Aidan has already put into the chat box. Use the Q&A box. There's another thing that says Q&A. Use that for your questions, please. And I think we will have time for some questions today from you, of our guests, or of our staff, or of us at the Canadian Nurses Association. So please put your questions in there. The discussion will be in English because that's my capability, unfortunately. However, we are joined by Josette Roussel, one of our staff, the executive advisor at the Canadian Nurses Association, who will be able to answer questions in French. And I'd like to turn it over to Josette right now to say a few words. So over to you, Josette.
Merci Claire. Bonjour à tous les participants et je vous invite à nous envoyer des questions en français dans la boîte QR ou dans le chat et nous allons répondre à vos questions. Je vais les traduire pour les participants, les panélistes d'aujourd'hui. Et Myriam est parfaitement bilingue, alors si on a des questions en français, on pourra les faire dans les deux langues. Je vous remercie de votre participation. Over to you, Claire.
Thank you, Josette. And also Myriam is able to answer questions in French as well, and then we might be able to help with some of the translation of that. So For those of you who are most comfortable in that language, please use the chat box or for your question. So we all know that COVID-19 has had a staggering, really a staggering effect on all aspects of lives for everyone living in Canada and around the world. However, we know that there are populations who were vulnerable before COVID-19 hit, who we were concerned about as nurses in all settings, but in particular in community health and in public health settings. And those vulnerabilities have, in my opinion anyway, have only been amplified and illuminated even more so during this pandemic. And the unique considerations and experiences of those populations, of those people, those families, those communities, neighborhoods, really must be factored into how we support populations. And both of our guests today are working with immigrant and refugee populations, although as you heard, they've got other experiences as well. But we need to be considering those as in our response, both now, but also as we move into recovery and into a possible second wave. So in the interest of public health, the Canadian Nurses Association feels and has been advocating to all levels of government to consider these particular populations, to consider their voices, to consider their issues and their needs, and to think about using this opportunity perhaps to implement policies, strategies that are long overdue in lots of ways to address both the social and structural determinants of health, and also to address the inequities that exist, the big inequities that exist. So today we're going to explore those challenges and with Vanessa and Myriam that they've seen as a result of the pandemic, but also some of the innovative solutions that they're both part of, or that they might think that we could advocate for or take action on the way forward. So I'm going to ask the questions now. So the first question that we landed on is, what are you witnessing? And we use that word really intentionally because as in our pre-meeting, as I listened to the conversation, both from Vanessa and from Myriam, they were using that word witnessing. And when we are witnessing something as people and as nurses, we can actually bear witness to that struggle and to those situations that we see every single day in front of us. So what are you witnessing, Vanessa and Myriam, as challenges, perhaps new, but also as challenges or barriers or issues with the communities that you are serving? So Myriam, I'm going to start with you and then come to Vanessa. And then the second question is about the innovations or adaptations or solutions. So we'll start with what you're seeing or witnessing as challenges with those populations and people that you're working with. Myriam.
So I'll just quickly say a few words about exactly what we do at Médecins du Monde. So because I think it's important to understand the context from where we started. So the broad mission that we have at Médecins du Monde is access to healthcare for everybody. So we have different clinics, and each program in our clinics address access to health for them, vulnerable populations. Myself I work at we call it la Clinique Migrants, which, as I said earlier, deliver primary care to migrant people with precarious status. So basically, it's people who have no medical coverage, neither public or private, and who have very limited resources. So for us, our challenge has always been access to healthcare. Over time, we've had to create different pathways, unofficial sometimes, to be able to get people to get the care care and treatment that they need. So in the context of the pandemic, it's I would say our main challenge is the same. It's access to care, but it's worsened. It's been very the situation has been worsened by the pandemic. It's also something else that we're witnessing. It's because we had to shut down our walk-in clinics. Now people have to call us to get help and to kind of get to get in touch with us. So it's harder to reach patients. So by the time that we get in touch with them, sometimes like we would have worked in prevention a lot, but sometimes by the time we get in touch with them, their situation is their health situation is exacerbated, or it's gotten worse. Also, what we see is that people are even like more precarious. There's a lot of there's a big lack of information because often they don't speak French or English, so they're not totally aware of what's happening. Also, they're very, very isolated, whether it's because they had already had a very limited network, or because something that we see also is there's a lot of fear associated with COVID-19 and being sent back to their country. So I know it's different for every province, but here in Quebec, they decided to make screening and treatment associated with COVID-19 available for everybody, which is I would say the base. But there's a lot of fear associated with that because people are afraid that if they go to get screened, or if they are positive, or if they need to go to the hospital to get treatment for COVID-19, they will be sent back to their country because they don't have a status, or because they weren't able to renew their status, or there's a variety of situations. But I would say those are the big thing that comes to my head in terms of what we're witnessing right now.
Thank you. So I think what you say is really, really important in that it starts with access to care, right? But as you talked, you can just feel and hear the layers or the intersections, right, of all of the different social determinants, whether it's, social inclusion, whether it's stigma and discrimination, whether it's language and the capacity to receive and understand information, or whether it's, precarious employment or precarious housing or precarious education, whatever that is, but it mounts, right? There's this intersectionality that occurs within and amongst those social and structural determinants of health. Thank you, Myriam, for that. Vanessa, what are you witnessing? What are you and your teams witnessing? And you work in a very different setting, but with a similar population in Toronto.
Thanks, Myriam, and thanks, Claire. Yeah, I would definitely agree with what Myriam has said. Insurmountably, COVID-19 has affected vulnerable populations to such a high degree. And, to be silent is to be complicit. And I think nurses are everywhere, and there are various ways to witness. And I'm not a very confrontational person, but I think that I'd like to just have an opportunity at some point in this conversation to discuss the various ways that we can witness and describe what we're seeing. I'm personally a big proponent of storytelling and trying to capture essences and feelings of what we're seeing, and how that can relate to what someone else can draw from as well within their personal background. And what I'd like to sort of have an opportunity to discuss now is a sort of sense of home. And we use the word home a lot in COVID-19. People say stay at home, work from home, homeschooling. I'm tired of being home. So there's a lot of words, a lot of sort of notions that are drawn around the word home. And most of us have an idea or a feeling or a sense of sort of what that brings to us. Yeah. But many people I work with just like we all are in many aspects or ways of our lives, are trying to create a home in various ways, through belongings, through rituals, through habits, through routines. And I'll give you an example which really struck me, and this is actually sort of aside from my work, as I was going down one of this sort of a pathway with my kids, and I was on my bicycle, and it was early spring, so you could see through all the trees, and it was about a kilometer path, and there was a ravine on either side, and you could see suitcases, probably at least about 10 along a kilometer path, that were open, and people's belongings were around the suitcases. And that image to me really captured the fact that somebody had packed that suitcase with belongings that were theirs. And even in whatever sense that they're traveling, they're trying to create a home or a sense of belonging in whatever they're going, wherever they're going to. So to me, that really hit home, and that really resembles something, right? And so I guess through the COVID-19, what I'm seeing is the many attempts to create that sort of sense of home and that sense of grounding and rooting have been taken away from people. I have a privilege of working in one of the largest refugee shelters in Toronto. I work there every Tuesday, and unfortunately COVID-19 did enter the shelter in 1, 3, 5, 8 cases. We went on site and did some testing, and approximately half of the shelter, so about 48 out of 80 people, were positive with COVID-19. So this sense of home, this temporary sort of community that people are creating, you have mothers and fathers and business people from all walks of life are living under one shelter in various rooms, and they're trying to create the best sense of home they can. And then they're being asked to sort of create physical distancing, and then there's this fear instilled around COVID-19, and really actually what is home, what they were trying to create, has been completely uprooted all over again. So I also just wanted to draw a comparison too in terms of COVID-19. I had a sense of, I worked in the largest women's refugee shelter that also had a very similar outbreak of COVID-19. And it was heartbreaking to go in, about 30% of the shelter was positive, which was about 40 people. And the response afterwards is quite, it's heartbreaking, because you're having to go into people's rooms, and these are the rooms that they created, this sense of home for them. And you're telling them not only that they're COVID positive, but that there's an isolation center that's available for them. And then you're asking them then to further move to cohort themselves with other positive people to create sort of a sense of reduction of the communicable disease. So the idea of PUIs is also brought up. You know, PUI stands for people under investigation. There are so many people under investigation that they now have an acronym for it. It's called PUI. And such individuals will often have to wait in emergency departments if they are considered underhoused until they actually have a result for COVID-19. The emergency departments often get upset because such individuals are taking up their beds, but it's actually not the fault of these people. Obviously, the emergency departments need to put pressure on the system and the society that's not creating proper housing for these individuals. So, I mean, really what I'm noticing is there's a significant reduced capacity in shelters because people are trying to practice physical distancing. So they're reducing shelter beds, and you'll see encampments being created across various parts of cities where people have no other place to go. This is fine now. It's actually not fine, it's never fine, but in terms of our weather in Canada, we can see it being fine right now. But what's gonna happen come November and December and January and February? This is what I'm worried about. So COVID-19 is not an equalizer by any means. It shows dramatic gaps. It really hits us in terms of our gap in social justice. And I just wanted to end on one point. In terms of, like, I've been able to have the opportunity to work with patients who have COVID-19, but also I recognize many patients that I work with also work with those who have COVID-19. So many of those who I work with live in shelters, but they have a potential to actually move out and get their own housing. And then as a wonderful way of providing support for other communities, they actually are able to work in shelters themselves. And so I think it's a really wonderful opportunity to connect with people who are working in terms of a full circle aspect, you know, in terms of those who we provide services for, but they're coming at COVID-19 from various aspects, which I think we can draw a lot of experiences from.
Thanks, Vanessa. And I think your answer to that question was very complimentary to what Myriam was saying as well. And I love metaphors, and that notion of home as a concept or a metaphor, I think is something that helps us to kind of crystallize what we're witnessing or what we're seeing, right? And thinking about people's efforts to create that home. So you did start, Vanessa, a little bit down the road there in terms of innovations or some of the solutions or things that you think even have the potential. You kind of started down that path. So maybe I'll give it back to you and say, so what are you thinking about in terms of innovations or solutions as we move forward? And I'm going to encourage our participants. We're a smaller group today, so you've got lots of opportunity to type in a question. Find that Q&A. We've got a couple of questions in there right now, but please make sure you ask your questions of Myriam and Vanessa. This is a really unique opportunity to hear from two different provinces, two different places, and from that really sort of boots on the ground perspective. So Vanessa, what about innovations or solutions for some of what you're witnessing or what nurses are witnessing?
Right. Yeah, thank you. I've actually really been pleasantly surprised in many aspects of the work that I've had the opportunity to do. I work in a larger institution. It's not a big one, but it's one that is considered a hospital. It's an ambulatory care hospital, and there's pros and cons to working with a large institution. But I think I really see such I'm really proud of the institution I work for right now. They've been extremely agile and nimble and responsive to community partners. Initially, when COVID happened, I thought I was going to be working in the ICU. Like, I have an acute care background as well. I was taking some critical care courses. And then I don't know why I didn't actually think about how the work I'm already doing would be amplified to the nth degree. As I reflect on that, it really struck me that I thought I was going to be working in critical care, because that's what we heard most about, right? So this also just shows, past conversations around populations that are vulnerable are not discussed that often, right? So what we do discuss is hospital-based care and acute care. So in terms of the community response, our hospital is an ambulatory care hospital, and we've really stepped up. And I think we've actually been able to identify, working with community partners. We created an assessment center, a COVID assessment center. And then there was a lot of requests to actually, go on site to places. It started with long-term care, but then we really recognized the need to actually expand much further and to go to community sites. So, we're fortunate to have a lot of community partners. We connected with various community partners, and we're able to create a mobile testing team. And then there's other opportunities, in terms of identifying the hospital's strengths, in terms of what muscle can we provide. We have HR, we have a lab, but we also really have to recognize our partners and how can we build capacity for other people. So there's a huge sector of developmental services. I think we're going to start down the road of actually training people in developmental services to actually do some COVID testing in their sites. So I think it's a sort of a trickle out kind of effect. I think people, I think many individuals really have to recognize their strengths and the innovative approaches they can provide. If it's, and I'm really profoundly pleased with where this is headed. We're also being able to test outside. So like in encampments, for example, we're creating sort of makeshift tables and doing COVID testing where actually the lab is involved after the fact. So we're doing the test results, we're creating labels, and we're sending it to the lab after the fact. So there's a lot of sort of agile work here, quite flexible. One size doesn't fit all, and I think that I've really been impressed with that, and sort of the opportunity to look at even training service providers. I've been blown away by the amazing skill and creativity of service providers, particularly in shelters, to be able to provide. So we can train service providers to provide COVID swabs, for example. Like there's I think it's really empowering, and I think we have to just keep up that momentum.
Thanks, Vanessa, and thanks for your optimism and your hopefulness in this kind of a situation. And I really like the idea that bringing the strengths of that acute care system, right? And your assumption, thanks for sharing with us that you thought you'd be in the acute care system, but actually have been I hear liberated in some ways to be out and about and creative and agile. And it's often in really urgent and emergent situations where that creativity does flourish, if you will. So capturing those innovations, capturing those solutions, I think is a really important aspect here. So Myriam, in our pre-meeting, I heard some really incredible innovation too, in terms of your work and the clinics that you're working in and the non-governmental organization, the NGO that you're part of. So Myriam, what are you hearing in response to that, or seeing and doing in response to the witnessing you've had?
So first of all, I'd like to say that we're still adapting. I think we found like a few solutions that work so far to keep delivering care to the population that we want to help. But we're still trying to improve as we go. We have the chance at Médecins du Monde. We have the chance to we're big on advocacy, so we actually have a team that works and do advocacy work. So just a few words on that. I know that they did advocacy at different levels, so at the city level, at the provincial level, at the federal level. So that's one thing, because at the beginning migrants with precarious status did not have access to didn't even have access to free screening and or treatments. So there was a lot that had to be done there, so like right now we're still working to get more. Like I know that in Ontario, the provincial health system, well, correct me if I'm wrong, Vanessa, but I think now you're to all healthcare, at least primary care, like not only COVID. So well, that's one example, but like, there's more work that needs to be done here in Quebec. So that's for the advocacy part. For our clinic, we had to stop actually for a week at the beginning because we didn't know how to adjust and keep delivering care, but being safe, for our team and for the patients. So we actually got kind of inspired by what they did in the public system in terms of, and I'm not sure if that's the term that you use in English, but in terms of hot clinic and cold clinic. So clinic where you treat people with symptoms of COVID, and clinic where you treat everything else, and especially not people who have symptoms. So we decided to adapt our services and developed a cold clinic, operated mostly over the phone. And so with that idea in mind, we kept the way we used to work. So at Médecins du Monde, our clinic for migrants is there's kind of 3 levels. So first, the person will meet with a social worker to really like have a global idea of all their needs and to make sure that nothing falls in the crack. So it's the same thing. Now they call in, they talk to a social worker, get their needs assessed, and then if there's a need for them to see telemedicine. And it's surprisingly, there's a lot of things we can do, and we also have quite a big group of volunteers, doctors. So with the help of doctors, we do a lot of things over the phone. And when we need to see the person in the clinic, well, we reorganize everything and have the proper protection and all of that to be able to see them face to face and assess them better. So that's what we did so far.
Okay, thank you, Myriam. And you also talked in our pre-meeting, I think, about making sure that people did have access to that technology, to the phones and to that, because many do not, right? That's been that certainly is an issue. So there's a question here from Vicky, and I think it's an interesting question for both of you to maybe to answer. And it's a population that I've been actually quite concerned about. So the question is, how are pregnant and postpartum, or those families with newborns and young infants, when they're immigrants or new to Canada, how are they doing? Sort of that's the general question, because Vicky says she's witnessing many Canadian-born moms and babies struggling right now, both in terms of access to care, being able to receive services that historically have been provided through public health, through nurses in the community, but also in terms of their mental health. It's a vulnerable period of time. So what are you seeing around that particular population in terms of immigrants and refugees with Canada? So Vanessa, I think I'll go back over to you and then come back to Myriam. What are you witnessing?
I do the mobile clinics part-time, but part-time I work in this refugee health clinic, and I agree with the question. A significant amount of concern that a lot of us providers have is in terms of how can we provide access to care. There are ideas of creating sort of group perinatal or postnatal counseling. But again, people have to have phones and have to have access to the internet. Some sites have sort of lending programs where you can lend phones, you can create hotspots for people to sort of connect, but it really is significantly concerning. And I think what we have, in some of the work I do, we think about those who are, sometimes it's visually people who don't have homes, will state it, or maybe perhaps it's more obvious for people who are living in encampments. But I think it's a really good opportunity to ask the question to everybody we see, are you having a difficult time right now making ends meet? There's food insecurity, housing insecurity, safety within the home, right? Isolation, physical isolation, and people are really having a significant compounding effect on mental health right now. So I think that that opportunity to ask everybody and check your own biases, and to ask everybody in terms of their personal comfort in this time, and run through those various options. I just wanted to draw your attention to a resource from the Upstream Lab. It's called COVID-19 Social Care Guide. I did give the link to it, and we can probably post it at some point, but it really is a screener for all patients and clients that really run through these aspects of food and housing security and concerns about physical safety. And it, like, sort of the idea of 211 is an excellent resource. At the refugee clinic I work, we have a newsletter that we put out every week, in an attempt for people to feel like, I know a lot of us are online, but it's really the only thing that we have right now. I mean, Myriam talked about the phones. It's okay. Sometimes you can do video, but you're right. Nothing really does beat like a connection, and I think we're all just doing the best that we can. I think that there are a lot of resources out there. So in terms of whether or not people can connect, that's another added level to be sensitive to, but 211 is an excellent resource, as well as on this Upstream Lab, they have a great link for social care guidance and social resources. So I know various public health units are trying to offer some sort of counseling programs. I think also we can't negate the benefit of even calling somebody and offering some supportive counseling and just calling and checking in. And I think if you're able to do that, I think that is significantly impactful for many people who are feeling isolated right now.
I think those are great ideas. And Vanessa, building that into your routine or your ritual in terms of how you approach people, those kinds of questions become more and more comfortable. And many times I know in my practice, people would come with a physical or some kind of more clinical question where really the issue was more of a social or safety or food insecurity, all of those things that you named. And you needed to ask those questions. You needed to bring that issue so that conversation could occur, and where you could start to find some
right.
solutions.
So
I think
Canadian benefits right now, exploring tax opportunities for individuals. Like I love paying taxes. That's why we pay taxes. I think to be able to offer individuals opportunity, if whether they are children, they can apply for, they have children, can apply for added tax benefits for children, for Indigenous communities. There's some for people with disabilities. So just really to be able to navigate that, it's not just up to social work. And I see a lot of people do that and refer, oh, social work will deal with that. But actually, in order to have social work sort of potentially navigate some of those areas, we have to ask those questions first. So like, are you having difficulty making ends meet? Talking about food security and safety in the home and isolation.
Yeah, great advice. Myriam, in terms of pregnant and young families with young children, what's the question?
Well, I don't have much to add on top of what Vanessa said. Just one thing that came to my mind. So that was a new issue in terms of, well, many things, but pregnancies. So we usually don't see tourists in our clinic. We really, keep our spots and our resources for people who are planning to stay here but don't have a status yet, or anyways. But now with the pandemic, we've had to open up our services a bit more, because there was women, or I'm just talking about pregnancy now. There's other health issues, but like we've seen women who came to visit families, and they were planning to go back because they were really just traveling, but they've had to have their baby here because they couldn't go back home, and some of them, the baby had some health issues, so we've had to do some advocacy too for that, to try to create partnerships, or sorry, I can't find the word, but corridor de service with the public system, and try to get care for those babies who are Canadian citizens because they were born here, and are most likely going to leave once they can, but they need care at the moment. So that was another issue that we've seen.
So thank you. There are a couple of other questions, and I think some of them we've addressed around the virtual and the telephone and whatever. But we're kind of coming to the close here, and I had asked if you would be prepared to give us some advice. And Vanessa, you kind of started towards that in terms of practicing nurses who are in our audience today, but we also have decision makers. We have those of us, as myself, as the president of the Canadian Nurses Association, which is an advocacy organization, so we have the opportunity to advocate. So we see influence and opportunity for leadership or advocacy at multiple different levels, and we know that inequities exist out there. We know that. They've been long known, they're long existing. And I really do believe that COVID-19 gives us an opportunity to make manifest, to bear witness to those inequities, and to move towards, a better and more just society. So I think it's an incredibly important opportunity. So I asked you both to sort of contemplate, and others can very much type, or welcome to type into our chat box. What are your two sort of best pieces of advice? Vanessa, you gave us one already. You can give us two more. The first piece of advice is to ask those questions. Make sure that it's in your mind, in your assessment, to ask the questions about income, about housing, about safety, about social inclusion, about mental health. Ask some of those tough questions on a regular basis. But Myriam, I'm going to ask you, what is your sort of two pieces of advice to any system level that you think we can do as nurses, as nursing organizations on the way forward?
Well, advocacy for sure is a big piece, informing yourself self to be able to be a good advocate. And I would say to think outside the box and try to find solutions. For having been having worked in the public system and now outside of it, I realized that there is kind of a pattern in the public system that we, all do things the way it used to be done, and keep doing the same thing. And you hear over and over that things cannot be done because it's always been like that, and it's not true. There are ways to do things differently. So yeah, thinking outside the box, I think, especially when you work with marginalized people, they are living in the margin, so you have to go there to live in the, so to be outside of the march. Yeah.
Yes, thank you. And people are so resilient that many of those solutions do lie with those people and with the population. So I hear also ask them, right? Talk to them. What are some of those solutions? But thinking outside the box, challenging the status quo, informing yourself, I think those are all really good pieces of advice. Vanessa?
Yeah, thanks. I would agree with so many things that Myriam said. Absolutely, I would echo. I think that know within yourself where you feel comfortable in terms of advocacy. Know where you can raise your voice and in what platforms. It's not really your voice necessarily, but it can be other things that you do where if you feel compelled to do so. There can be various ways to do things. Recognize where things can be done in different ways. Look at community partners and who has strengths where. In terms of, for example, the hospital where I work, it's a community care hospital, it's an ambulatory hospital. We have human resources in a lab, and community partners don't have that. So how can you look in terms of the scope of the community that you provide and who can actually complement each other? Look, like I said, look for various actors within the healthcare response, integrate, find new, unique and novel ways. Don't be afraid to raise your voice and to offer experiences in your fresh eyes. If you have fresh eyes on its response, it's needed. Like fresh eyes are always needed on something, and we can never negate the importance of that.
Thank you. Those are really important pieces of advice and actually doable, right? I mean, those are things that we can start to do in the next hour and in the next days and weeks as we move forward. Being an advocate, doing advocacy requires practice too, right? So it might feel awkward, clumsy, a bit not effective the first few times, but I agree with both of you. Use that voice, use our collective voice. And Vanessa, I actually thought you might say, tell a good story.
I think it's like, know where you can witness. So know where you can be an advocate, know where you can witness. For me, that works for me. Some people are really great at doing research. Some people are really great at doing public speaking, but I think it's know where you feel your skills and your interests lie best, and how you can push those in various ways.
Yeah, I think that's really, really sage advice. So thank you both very, very much for that advice. I'm just going to take a minute to thank our staff, the Canadian Nurses Association staff, Elizabeth Moran. We would not be able to manage the technology without Elizabeth. She's just so steadfast and just really makes it feel secure and safe as we move into these conversations. To Aidan and to other members of the Aidan Hamza and the other members of the team, the policy team, as we call them, for their very, very good and thoughtful work and for sourcing the topics as well as the speakers. So thank you, Aidan, and to Carrie and to Josette and others that have supported these conversations. Today is the 9th conversation. I can't believe that, but it is the 9th. We will have one more, a 10th conversation, and then we'll close the series. And that conversation will be on the 19th of June, so 2 weeks from tomorrow, same time, on a Friday. And I'm thrilled to tell you that Tim Guest will be my guest, and we're going to talk a bit about the future of CNA. We'll contextualize it within COVID somewhat, but we're really going to look at the brand and the way forward for CNA as we transfer it's an actual chain of office between myself and him. So please consider joining us then. It'll be on the 19th of June, and I really look forward to that. And that'll be our 10th and final Coffee with Claire. So thank you so much for joining us today. I don't know, Elizabeth, are you putting up a poll question right now? Maybe not, but there it is. Usually we just ask you how likely you are to use the information that was provided in this webinar, in this conversation. And I think both Myriam and Vanessa have given us some very practical tips, very practical advice, and very practical ideas in terms of our witnessing and bearing witness to those issues of equity and how to address both the social and the structural determinants of health every day in no matter what setting we work with or in. So thank you so much for joining us today, and we'll see you on the 19th of June. Thank you again. Bye now.
Thank you. Bye-bye.
Thank you, Claire.